Imagine this, you're slowly going blind. The world is getting hazier every day until you can barely see at all. But someone says they can fix it. They pull out a sharp needle and tell you to hold still. This isn't sci-fi, it's ancient eye surgery, and it's how cataracts were treated for over 2,000 years. Today we're diving into one of the oldest surgeries in human history. From ancient India and Egypt to Bach and Galileo, this is the wild, often terrifying journey of how humans battled blindness and how we finally won. But first, what exactly is a cataract? A cataract happens when the lens inside your eye becomes cloudy. Normally, this lens focuses light onto the retina like a camera lens. But with age, injury, or illness, the lens can become foggy, blurring vision like a dirty window. Left untreated, it can lead to complete blindness. Let's rewind to 6th century BCE India. Meet Sushruta, a legendary surgeon often called the father of Indian medicine. He described over 300 surgical procedures in his ancient text, the Sushruta Samhita. And yes, he included cataract surgery. But here's the twist. They didn't remove the cataract. Instead, they used a sharp needle to push the cloudy lens down and out of the line of sight. The technique was called couching. The good news? Sometimes it worked. The bad news? The patient was now functionally farsighted with no lens and no anesthesia, antiseptic, or antibiotics. The Egyptians and Greeks adopted couching too. In fact, Roman encyclopedist Celsus described the procedure in the 1st century CE. They believed blindness was caused by humors collecting in the eye, so pushing the lens out seemed to, quite literally, clear the view. But even royalty and genius couldn't escape cataracts. Galileo Galilei, the father of modern astronomy, went blind in his final years, likely from untreated cataracts and glaucoma. Johann Sebastian Bach, the legendary composer, underwent cataract surgery in the 1750s by a traveling British eye surgeon named John Taylor. It did not go well. Bach became completely blind after surgery, possibly from infection or complications. He died months later. It wasn't until the 18th and 19th centuries that things began to improve. Doctors began actually removing the lens entirely instead of just displacing it. But outcomes were still risky, until the invention of antiseptic techniques and better surgical tools. Fast forward to World War II. British ophthalmologist Harold Ridley noticed that injured pilots with plastic shards from airplane canopies in their eyes didn't have rejection reactions. Why not use plastic lenses to replace the clouded natural ones? In 1949, Ridley implanted the first intraocular lens, IOL, changing eye surgery forever. Today, cataract surgery is one of the safest and most common surgeries in the world. Using phacoemulsification, a tiny ultrasound probe breaks up the cloudy lens, which is then suctioned out and replaced with a clear artificial one. The whole thing takes about 15 minutes, no stitches needed. From stabbing needles into the eye to painless outpatient procedures in under half an hour. The history of cataract surgery is a reminder of how far medicine has come. We've literally gone from blind faith to precise science. If you found this fascinating, smash that like button, subscribe, and check out our other videos like how to build a microscope on a deserted island.